Dr. Lori Medeiros is with us this morning. She's the medical director at the Rochester General Breast Center, and we're talking about the breast cancer gene and also the importance of genetics and your family history in calculating your risk of breast cancer. Welcome this morning.
Hi, how are you?
Thanks, Doc. Thanks, Hector, for coming in. When it comes to this particular pool of knowledge we have now that we didn't used to have,
right,
a lot of information can be a really good thing.
Yeah.
How do you manage that information? What do we want to know about our genetic history when it comes to breast cancer risk?
Well, you know, Mother's Day is coming up, right? So it's always a good idea to, have some time with your mom. But one of the things that, people don't ask about is family history. So, there's some things that I see in the practice that I think are helpful for people to remember when they're trying to find out about family history. So of course, what your mom's gone through and what her sisters have gone through, but often your mom knows a little bit more about your dad's side of the family than anybody else, Paternal lineage is important for us because breast cancer, there are certain genes that can manifest as breast cancer on the male side that may not necessarily manifest in the dad, but may manifest in kids, right?
Wow.
So really important to ask not only about her side of the family, but about your dad's side of the family. So the kinds of things that you're looking for really are not only breast cancer, but other kinds of cancers that we see with gene mutations. So things like ovarian cancer, sarcomas, thyroid cancer, there's a lot of it. So you just kind of want to get an idea of what happened. And sometimes that information might not be necessarily clear.
Because generations ago they might have just kind of not talked about it.
Right. So you hear a lot about somebody dying of a woman's disease, or sometimes, I've had people come in and say, oh yeah, my aunt had a mastectomy and she was fine and she didn't have cancer. But generally we don't do mastectomies for things that are fine.
Yeah, right.
So going around it a little bit, that's really helpful in terms of trying to get that information. And that's critical because there are a lot of things that we can do to prevent breast cancer, and not just breast cancer, but some of the other cancers that are associated with certain genes, so that's really important information.
Looking at your family history, your family tree, it almost seems like a formula. How do you put that together, and in terms of then when is the right time? Do you say to a person, you should be tested or screened?
Yeah. So we have a pretty robust high-risk screening program at our breast center. Part of what we do, we partner with a risk institute over at Dana-Farber, so we do some of these calculations, and they're actually bounced back and forth between the institutions. We take into account a lot of things. So aside from family history, your own history of having biopsies or having other breast-related issues, weight, history of hormone exposure, things like that. These are all things that are factored in. And the other thing, I'll make a plug for this too, since we're talking about Mother's Day and family history, is really trying to get into this thing of mammograms, right? So a lot of women find it easier to go together. Certainly, if you can have that conversation with your mom and your sisters and, plan your mammogram, it's still the best tool that we have in terms of detecting this early.
We've got about 30 seconds left, but I'm coming away with make sure you have that conversation, whether it's Mother's Day or not, but that's a great excuse to have it. We've talked a lot about what do you do with this knowledge about your genes once you have it.
Right.
But this is about just get the knowledge first, then a decision can be made going forward.
Bring it up with your doctor, and, people are aware of this. Is what happens a lot of the times is it gets kind of lost in that conversation about whatever else is going on. So having that knowledge, bringing it in, and hey, is this something that's worth pursuing, is the first step. And we certainly have the ability to do something with that.
Great.
Yeah. All right. Well, thank you so much for your insight. It was good to know.
Have that conversation.